are listening to the most original talk radio station anywhere. We are LA Talk Radio at latalkradio.com.
You're listening to Peace Fund Radio with Adrian Paul and Ethan Dettenmaier, right here on LA Talk Radio.
Hello. Good morning, everybody. How are we all? Okay, you can't reply to that, unfortunately, because you're across the airwaves, except I have one person in here that can. But he's not talking to me today.
That's not true. I'm happy to reply to it if anyone actually cares what my answer would be.
Okay, I care, Ethan. I care.
I'm fantastic, thank you. How are you?
I am. Actually, I'm coming down with a little bit of a cough, actually. I think I got it in Calgary this weekend.
I was going to ask. I thought you were actually in Calgary this week.
No, this weekend. Last weekend from Thursday till Sunday night. It was a very interesting time in Calgary because the weather was, when we got there, it was about 60, 70 degrees. And the next morning, it was -2. And then the next day, it was 60 degrees.
At this time, it's that cold.
It was very, very odd.
Now, what are you doing in Calgary? Can we discuss it?
Signing autographs, pictures, talking to the fans.
Are you here next week?
Am I here next week?
In studio?
I am indeed.
Okay. Just
curious. Why? What's the issue here?
No. There's no actual issue. I was just kind of curious of what we as producers in a professional realm of radio may need to prepare for. And I know you're in demand.
Well, actually, I have some interesting guests we might be getting into the studio very shortly. A couple of my old friends, a couple of people I've met this weekend, but I'm not going to mention anything until they've actually confirmed definitely.
That's the way
because you
it
never
works.
do that. I want to talk a little bit about the tornadoes that are going on right now. There have been 27 confirmed weather-related deaths and more than 200 people reported injured across Arkansas and Mississippi. The hardest hit of 6 states struck by the storm system as tornadoes reduced homes to rubble, shredded trees, and launched vehicles into the air. Deaths have been reported in Oklahoma, Iowa, Alabama, and Tennessee. President Barack Obama has declared a major disaster in Arkansas and ordered federal aid to supplement state and local recovery efforts, the White House has said. Shelters have been set up for thousands of families forced out of their homes while the National Guard, local police, and residents who lost all their possessions sifted through the rubble looking for more victims. I think it's when something like that hits, I just don't know how you cope with something like that.
I have no idea. I don't even know what the procedures are for a tornado, to be honest with you, other than what I saw in The Wizard of Oz.
I think what you find in things like this is the places, the people that are doing good, that will help others. And I'm sure that many of you out there may even know people that have been hit or affected by this. And our prayers go out to you. I hope the efforts are successful, and I hope the weather lessens. It's very odd because over here we've been having a lot of wind over the past 2 days. I've been really surprised. I mean, I looked out of my house and the trees are bending over, and I'm wondering if it's something to do with that. I mean, have you noticed that?
Yeah, some serious wind in my neighborhood.
Mother Nature is something that we cannot control, but the things that we can control are the things around us. And this morning we are going to talk about dental care, which is something that we at the Peace Fund have discussed and dealt with before. We dealt with an organization in Romania, Relief Fund for Romania, who the Peace Fund actually helped put a dental clinic into a place called Voltareni in Romania, a small village that had no dental office, and kids' teeth were rotting. It's awful. I was actually talking last night to my wife, and she said, it's really interesting how parents give things to their kids that they think is, I just shut them up. And things like, she said, my friend was sitting there with her friend whose daughter was 5 years old, 6 years old, and she's giving her packets of sugar.
Like packets?
Packets of sugar. Now, not only did the child go to bed at 1 o'clock in the morning, I wonder why, but the child's teeth are totally in very bad shape. And her other friend puts 5 teaspoons of sugar in the tea or in the water that she gives her in the morning, and the kid just scoops out the sugar and eats it. Don't you get it? This not only affects your child's physical position during the day, but it also rots their teeth for a very long period of time to come. It's very detrimental. Sugar's one of the worst things you can actually give to your kids.
I get it. I hope most parents aren't doing the same sort of
they
dietary
do.
supplement
You'd be surprised how many
doing.
people do it, because, I mean, sometimes you just want to sort of mollify your child because they're going off the deep end. And my son sometimes goes off the deep end, but you've got to sort of find other ways to...
Well, what are your methods?
Lock them in a room and close the door. No, I don't do that. Basically, it's called redirection a lot of the time. It's redirecting their wanting of something to redirect it. My wife's very good at it. I'm not as good at it as she is. You've got to redirect them into giving them something else that they might be interested in, like a balloon or something else they might want, the car, the doll, whatever that is, and redirect it from the sugar or the cake or whatever that is that they're pining for at that time. I mean, almost everyone is aware that hunger and poverty and general poor health of kids who live in third world countries, but we don't think of dental health. It's one of the things that is, it leads to pain, loss of tooth, infection, even death. I mean, think about that. I mean, you're not even just talking about, having bad teeth. It's also death because the infection can spread.
It's an infection in your mouth can spread.
It can spread. Yes, it can spread from your mouth. The dental cavities and gum diseases are the most widespread diseases in the world. So, children's dental health plays a critical role in overall health and well-being, and requires attention starting at an early age and routinely throughout their lives. I was funny, that was coming into the office knowing that we were going to be doing this morning. I had my checkup about 6 months ago, and they're like, you've got to clean your teeth every 6 months. Got to do it. And I was looking for the phone number. I was going to call the dentist on the show this morning. I probably will do in a minute, but just because otherwise I'll forget to do it, and you keep forgetting. Then another 2 months goes by, another 3 months, and then it's a year, and all of a sudden you've got a cavity, and you're in pain. And that's not when you go, because you lose teeth. My good friend of mine just lost it. In fact, 90% of cavities in children in third world countries basically go untreated. 90%. Despite the good intentions to address this issue in these countries, children's dental health, 75% of them do not have the funds to support essential dental services for children. Therefore, it's left to volunteers, dentists, dental hygienists, assistants, dental students, as well as concerned individuals. And actually, that's what we found when we were in Romania. We actually had doctors that actually gave up their time to actually go once a week to this particular village, once or twice a week, I believe it is, to this village with a dental nurse, and we supplied all the equipment and the place and supplied all that. And now they have dental hygiene that the local community, as well as most of the kids, go to on a regular basis.
Brilliant.
So I think it's important, and it does not cost that much to do. To actually, when you have, this is one of the focuses of the Peace Fund, is the fact that we are able to bring resources together as well as funding from different sources. The funding is not the issue. The funding of medical equipment and that is what costs the money, but the manpower and the resources of intellectual ability is a totally different matter.
Would you find that that's part of the problem here with dental hygiene, is the cost of a dentist for many Americans?
Well, I mean, you look at, I'm with a dentist at the moment who...
Fear of dentists,
Fear of dentists. God, I was terrified when I was a kid. I mean, they took out...
Aren't you still scared of dentists? I mean, you were in the other room saying you'll never go to a dentist again because you're afraid of it.
You are lying. You are lying.
Have you gotten over that yet?
I don't like dentists, admittedly, but I mean, they're so much better than when I was a kid.
I know.
Totally
Aren't they? Wow.
So really are. But that said, for instance, when you go to the dentist, everybody, remember something. There are other ways to actually get some of the supplies that they give you. Their manpower is one thing that costs money, but the supplies they give you, such as teeth whitening. I went to my dentist here gave me wanted to give me the trays and wanted to give me the liquid to put into it, and a pack of 4. They were going to charge me, I think, $75 or $100 for the pack of 4. $75.
What's wrong with the Crest mini whitening strips?
No, those don't work quite the same. No, don't work quite the same. But what I'm saying, the exact same thing I found online for $25. So when you do 2 sets of those, it's $150 instead of $50. it's ridiculous. Look online. There are other places to find some of these things. And some dentists do the same thing, but because of where they're located, location, they charge you more money to actually do the dental exam. And it is not covered. Most insurances is one of the things you don't get as much coverage on is dental insurance. Now, United States, we talked a little bit about foreign countries, third world countries. Oral health, it's neglected in your children's health a lot of the time. And healthcare, it's the single greatest unmet need for health services among children in the United States is another thing. So tooth decay is the most common chronic disease among kids between 6 and 18. Untreated dental problems such as cavities and gum disease can affect a child's health and quality of life by leading to pain, nutritional and sleep problems, impaired concentration, and increased school absences. As we've said many times on this, most things have one root, and they have these tentacles that go off in so many different directions that affect kids in so many more ways than what the original problem is. If dental disease is not treated early, it can result in the need for more serious and expensive intervention later on. I mean, do we have John Bierly there? I'm curious. Is John around?
He's here. Obviously, I'm not a stellar conversationalist when it comes to dental.
Good morning, gentlemen.
Good morning, John.
Wow.
How are you?
He's obviously in a tornado zone.
How are you? Actually, that probably sounded like he was a second ago, didn't it?
Yes.
John, how are your teeth?
My teeth are good. I'm 38 years old with 2 cavities. I don't think that's too bad.
2 cavities? That's not bad.
I've had 2 cavities in my entire life. I don't think that's too bad.
I got him beat.
Oh, well, no, I've had plenty of cavities. I had cavities when there was just so many when I was a kid because, actually my dentist took out a couple of teeth or gave me fillings when I didn't need them. That was the funny thing when I was a kid.
How would you explain that?
I don't know. It's called money, and when
really,
yeah, when you think about it, when you do a filling. I mean, in England, we're talking about in England. Yeah, the English are not notorious for having good teeth.
Well, I knew that, but I mean, you don't have socialized dentistry?
No, you pay for some of it.
You pay for some.
Yeah,
of it.
so
okay.
I think now it might be a little.
Why don't you
different.
get yourself just a nice, cool gold grill?
I think I should just cool. That would have been a good idea. Cool gold grill.
Yeah, why don't you just go like that? Just do it like the hip hop kids. Who cares about your teeth? You can just put gold in your mouth.
That's true. That's true. I could be worth a lot more. So, John,
let's not push it.
So, John, you've never had any tooth decay. Any of your family and that go to the dentist regularly?
Oh yeah. All of my let me step back for a second and say that I think one of the reasons that my teeth are good is that for the last 16 years, my day job is actually working at a dental office. Oh. I sit in the basement of a dental office and argue with insurance companies.
You're cheating. You're cheating.
No wonder you have fabulous dental hygiene.
Well, it's and I wanted to actually I have some information that my boss prepared for me. My boss is Dr. Wilson Stem of New Albany, Indiana, and the only reason I am able to do Peace Fund Radio every week is through the kindness of my boss, because in Los Angeles right now it's it's about 11:15. Here, it's in the middle of the afternoon. So on Wednesdays, my boss allows me to take a very late lunch so that I'm able to do the show on a belated lunch hour. And I'm very appreciative to him that I'm able to do that. So thank you very much.
One more time with this very generous dentist.
What's your boss's name?
Yeah, one more time with this dental office address.
Yes, Dr. Wilson Stem in New Albany, Indiana.
Dr. Wilson Stem, you are a hero of the week.
Yes. And like you said, he knows that being able to do the show is important to me. He believes in the work that we do on the show. So again, he has always been very, very gracious in facilitating my ability to be on the show by letting me take a late lunch on Wednesdays. So
we need to send
thank you, boss.
into Guatemala on behalf of the Peace Fund to open up a dental clinic over the weekend, and he can help all these impoverished kids. How about that? There's our manpower right there.
There's our manpower. I mean,
straight love to. And I actually invited him earlier today to maybe come on the show for a few minutes and share some information with us. But again, like I said, it's in the middle of the afternoon here, so he's in the middle of some crazy dental procedure.
He's drilling at the moment. Don't you hate that sound? I used to hate that sound.
So Dr. Wilson Stem.
Yes, and Stem with 2 M's. And again, just remember that even though we don't like that sound. You don't like the those noises in your mouth and all those things. It's promoting lifelong health, not just oral health, but complete. Your health starts with your teeth. I was talking to the doctor this morning. He says that the American Dental Association recommends that children first be seen at about a year old, which is actually about 6 months after the eruption of their first tooth. That most kids have 20 teeth by the time that they are 2 years old. He recommends that at that 1 year visit, it's good because it gets the child used to going to the dentist, kind of builds what he calls a safe dental home, so that if the child does have a cavity by the time that they're maybe 3 or 4 years old, it's not the first time that they've visited the dentist, which means that they're less likely to have a negative experience. Right. They're less likely, to be nervous, because bad experiences early on may make them, afraid to go to the dentist for the rest of their life, and you obviously don't want that. And he said another important thing about that 1 year visit is that the dentist is able to check for developmental abnormalities that can be seen at an early age that can be related to other syndromes. So sometimes a dentist can look at a child's tooth development and say, okay, based on the way these teeth are coming in, based on problems that I see, these could be indicators of other diseases, other illnesses, other syndromes. So it's important to kind of get that early visit to the dentist to, kind of get a foundation for the dental health for the rest of the child's life.
They actually say here also, they also say here, John, that American children miss about 1.6 million school days each year due to dental disease, and low-income children miss more days than children in families with average or high incomes. That's probably because they're insured and they can go to the dentist. But I mean, it's right. The facts are huge. I mean, when you're looking at these numbers, I have them in front of me now. But sorry, carry on.
Well, there's something that's called intrinsic fluoride, which is the fluoride that is added to our water. And, over the past few years, the American Dental Association has put less of an emphasis on that. It's not enough. The research within the last 2 to 3 years say that the topical application of fluoride, rather in a varnish or a foam, after a dental checkup, is the best way to get fluoride to those teeth, because it's applied directly to the tooth structure. And he gave me some really cool chemistry about how the fluoride changes the hydroxy apatite, which is what your bones and dentitions are made of, changes a hydrogen to a fluorine. Very complicated chemical stuff that basically means that direct application of fluoride makes the tooth structure more resistant to acid attack. And there are a lot of little ways that sometimes parents don't realize they're harming their children's teeth. There's something that's called baby bottle caries. Caries are another word for cavities, where the child is put to bed with a little bit of milk or juice or Kool-Aid, and there's sugar in that stuff. So that basically, if a child is, put immediately to bed after having, had some of these things, you can basically have the equivalent of meth mouth in a 1-year-old.
Wow, meth mouth.
Really, meth mouth?
Such an attractive term for a younger person.
Yeah, that sometimes he's seen cases where the cavities are so bad that in small children that it's shocking. And the other important point that he wanted to make is that it takes sugar to make cavities. Most people think, well, if I have a soda with a meal or eat something sugary for dessert, brush my teeth, I'm fine. But if you're sipping on sugary beverages throughout the day, you're basically incubating an environment in your mouth where sugar is just sitting on your teeth and breaking them down. So it's it's one of those things that there are constantly things that we need to be on the defensive when it comes to taking care of our teeth, and it starts early. And if you can get your kids comfortable with going to the dentist from the time that they're very young, then that's make sure that they're going to be maintaining good oral health and good oral hygiene habits throughout their entire lives.
I do that with here's another situation here, John. When you have a 2-year-old or a 1-year-old or 3-year-old or whatever, there are times kids like to bite. And I could just imagine, I'm sure the dentist could give us some instances where he's put his finger in the kid's mouth and the kid doesn't want it and gives him a good... How does he deal with that? I mean, how do you pry open the kid's mouth to try and look at its teeth?
Well, we have, I think that the dental practice in which I work, it's owned by a family, it's operated by a family, it caters to families, and you always just, sort of try to, bring it down to the kids' level and, talk to them and, get them comfortable. It doesn't always work. It doesn't always work. And there are pediatric dentists that, in some cases, if a child just is that uncomfortable, they can refer them to a pediatric dentist who that's their expertise, is getting through to those kids who are just too afraid, who just can't quite bring themselves, to open up their mouth and let the dentist take a look. So there's always an answer out there. Never think that, I took my kid to the dentist and he was afraid, so I'm just going to give up. There's always an option. If you really want your child to have good oral health, there are always options out there. There's always someone who's going to work with you if you'll let them.
It's interesting, John. Oral health has really sort of come to the fore in the past 20 years. When I was a kid, it was kind of like you go to the dentist just to check up and see if you've got anything wrong. You fix it, and you're on your way. The idea of actually kids brushing their teeth at as early as ages 2 or 3 years old. I mean, I do it to my kids, but my son doesn't really want to do it. He just wants to bite on the toothbrush. So, as a professional, I know that what we do, we try and make it fun. We do like a little game, like, we go, brush your teeth, brush. You just do a game with it so that they kind of and eventually, it doesn't happen overnight, but eventually they start having fun with it and they start brushing their teeth. Now my daughter actually brushes her teeth really well, except she sucks her thumb, therefore her teeth are coming forward and she's going to need dental orthodontics later on. But anyway, is that something that the dentists teach kids as well? How to actually brush their teeth and how to teach parents how to get their kids to brush their teeth?
Oh, yeah. We have all kinds of printouts that we give to families that have information, that have, like little connect the dots, like coloring book type pages that have information. Like I said, my boss has always been really good about supplying families who come to our office with information that they need to make it fun for the kids, to kind of make it an activity instead of a chore to brush their teeth. And another important thing too, and this is not only for the kids but adults, when you brush your teeth, make sure that you're brushing your tongue as well.
Right. Yeah.
Because that's the tongue is just this wide, flat area that's just an absolute breeding ground for bacteria. So if you can brush your teeth, but if you're not brushing your tongue, you're not getting rid of a lot of the bacteria and things that are really there to cause trouble in your mouth if you let them.
Actually, when I went to the dentist 7 months ago, they said to me, try an electric toothbrush. I now floss my teeth. I use a dental pick and I brush my teeth, and I use, not all the time, but some Listerine stuff afterwards. So because in between the cavities where it's at, you just can't get to it right inside, and that's what sits there and rots your teeth. Exactly. Too, and Adrian, earlier you mentioned orthodontics. I got braces when I was 25 years old. My teeth had always, growing up, they were never perfectly straight, but it never really bothered me that much. And my parents were always like, "Oh, you should get braces." I'm like, it doesn't bother me that much. Well, when I was in my mid-20s, I had my wisdom teeth removed. My wisdom teeth were just massive. So with them gone, my teeth shifted a little bit more. So I'm like, all right, I'll bite the bullet and get braces. And so again, I had braces when I was 25 years old, and they completely straightened top and bottom teeth out unbelievably. So I know that's it's an expensive option sometimes, I realize, but the earlier you start, the earlier you start looking into that, the better, because you don't want to be like I was, a 25-year-old guy walking around with giant metal braces on his teeth. Plus, that was more than a few years ago. So they also have all kinds of new technology and other options that are out there for straightening teeth as well. So again, there are always options out there. Never think that
oh, it's too expensive, it's too this, it's too that, it's too difficult. If you really, truly do want to take care of your teeth, there are always options out there.
Okay, I was just curious because I actually had my wisdom teeth out when I was similar. I think I was in my 20s, early 20s. And I remember they didn't take 4 out, they took 2 out. They took 1 out and they took another one out. The first one came out was okay. So took the second one out. It was all right until I got outside the dental office. Then it started bleeding. And it didn't stop bleeding for about 6 hours. I had so much blood in my mouth, I had to go to the hospital. I lost so much blood because of it. I mean, obviously there was something that didn't go right when you do that. I mean, I think it's kind of wisdom teeth. But did you have your wisdom teeth out, Ethan?
I did. I had 4 impacted wisdom teeth, and they pulled them all out on the same day. And I was fortunate enough to get to the airport right after and get on a plane to Hawaii, which really helped with all that because those whiskey minis they have on a plane can really get you through your post-op struggles. Do
you know where the word wisdom teeth come from, John?
No, I don't actually.
They usually were actually called third molars. The common name is wisdom teeth because they appear so late in life, much later than basically the other teeth, basically at any age. So that's where it actually comes because presumably people are wiser than a child, so this is when the teeth erupt. That's where, for those of you that never knew why you actually had a wisdom tooth, that's why it's called a wisdom tooth. But let's just go back to what we were talking about before, about kids and dental health in the United States. 17 million low-income children in America go without dental care every year. Represents 1 out of 5 children because between the ages of 1 and 18 in the United States. The problem is critical because the consequences of a simple cavity can escalate through kids' childhood as well into their adult lives, from missing significant number of school days to risk of serious health problems and difficulty in finding a job. So different things such as early growth and development cavities are caused by bacterial infection, like you said, John. For kids at high risk of dental disease, the infection can quickly progress into rampant decay. So there are so many different reasons why we should have healthy teeth.
Absolutely. Again, it's something that is so simple to take care of if you're just willing to put in the time to do it. And I brush, and again, it's probably because I work at a dental office, and all day long I do insurance paperwork for people who have got really, really huge, really, really serious dental problems going on. And I think it's probably one of the reasons that I'm so attentive to my own teeth, because you think, man, I hope my mouth is never in this shape. I usually, I brush my teeth in the morning. I brush them before I go to bed. I rinse mouthwash in the morning. I rinse it before I go to bed. At lunchtime, after I eat lunch at work, I'll brush my teeth there. It's just, maybe it's just one of those things where I feel like it's because I'm so familiar with what can go wrong if you don't take care of your teeth through my work, that you think, oh gosh.
It's interesting as well. As the question is, why are we having a crisis in teeth? I mean, obviously, it's the same thing as we had last week when we were discussing autism. Autism has been now identified as autism, but prior to that, it was actually grouped into mental, they call it retardation, or whatever they call it. It was a mental disease, whereas there are so many other mental diseases that it's just grouped into one. Same thing with dental thing. I don't think we really realize that a lot of our problems in life, the diseases and the stuff that we were having, came from our teeth, because that's the one part that we actually are open to a lot of viruses, is your mouth. And so when you've got sugar in there, when you don't clean your teeth and you leave the bacteria inside, it causes other problems throughout your life. And as parents, you should give your kids good hygiene and a proper diet to help your kids' teeth, because the other thing is there are 3 factors that have a significant role here. Too few children have access to proven preventative measures, including sealants and fluoridation, which is what you talked about, John. Mm-hmm. Too few dentists are willing to treat Medicaid-enrolled children. And in some communities, there are simply not enough dentists to provide care. So
wow.
That's an interesting... that fact there, that's in the United States. We're not talking about anywhere else. That's in the United States.
It's staggering to think about because it seems like there's a dentist on every corner in my neighborhood.
Yeah, but that's your neighborhood.
Right. So it's hard
look
to
look at other places.
Exactly.
And then you have to identify a good dentist. How do you identify a good dentist? I mean, a lot of times it's referral. How do you, John? How do you, let's say you were somebody that, was looking for a dentist, you moved to a new area and you're looking for a dentist. What do you do to figure out if it's a good dentist? Is there an association to look at?
Well, I think one of the ways that honestly most people choose a dentist is whether or not their insurance is accepted by the dentist. Mm-hmm. We get phone calls all the time where people will say, "Hey, this is the insurance that I have. Do you accept it?" And even if a person thought that a dentist wasn't that great, they would probably still want to go there anyway because it would be cheaper for them because of their insurance. There are things that are called preferred provider organizations, where our dental office, for example, is in network with practically all of the largest dental insurance companies: MetLife, Humana, the Delta Dental companies, so that when someone comes to our office, they pay a percentage of a discounted rate. For example, if we would charge $100 for a certain service, and Delta Dental's contract network fee is, maybe $65, $72, whatever it is, we discount down to that number, and then the patient would say they owe 20%. The patient's copay is 20% for filling. They would only owe 20% of the 78 rather than 20% of the full 100 that we might charge. So people are often going to go to dentists that are in network. Plus, the average, I'd say almost every dental plan that I look at over the course of a day will pay up to $1,000 maximum per year with a $50 deductible. Sometimes if you go to a dentist that's not in your network, your yearly maximum will be lower than that. Your deductible will be higher. Your dental insurance wants you to go to a provider who is in network with their company, and sometimes you have dramatically reduced benefits if you go to a dentist network. So honestly, to answer your question, I think a lot of people choose a dentist just based on who is in my general area who accepts my insurance. That's where they're going to go.
Let's talk about insurance for a second, because according to the most recent comparison, privately insured children are basically almost 30% more likely to receive dental care than those who were publicly insured through Medicaid or other government programs. Now, why Medicaid? I mean, I've never really sort of looked at Medicaid, but in 22 states, fewer than half of Medicaid-enrolled children received dental care in 2012. It's a sobering number, because 14 million low-income kids didn't see a dentist in 2012. They live in areas where there's a shortage of dentists, or a shortage of dentists who participate in Medicare. And I was looking at this, I'm like, okay, so what's the problem? You've got a shortage of dentists. It stops them and the adults to access dental care. It's the dental shortage. That's one thing. But the Medicaid, why Medicaid? And I was looking at it. I'm looking at these facts here. It says it's due largely to federal law requiring Medicaid extend dental benefits to low-income children. They are more likely to have dental coverage than higher-income peers. However, there are a number of barriers to using Medicaid coverage to access care, and one significant obstacle is that many dentists don't accept publicly insured patients. And the reason why is that there's low reimbursement rates and burdensome administrative procedures. Dentists don't like dealing with the billing process, and their offices are not especially accessible to Medicaid recipients because they have a reputation of having higher no-show rates and aren't always viewed as the world's most profitable or attractive market segment. It's all about money.
Yeah. Well, it is. Our office does accept Medicaid. It's one of the few in our geographic area that does. So again, if these families that are on Medicaid, if there's the parental initiative there to bring their kids to the dentist, they can pretty well get most procedures covered. The problem, though, sometimes is that parental initiative. And Adrian, as you just said, there's a very large percentage of of no-shows where, people will call and they'll make an appointment, but they just won't show up. Mm-hmm. So that makes me sad, to think that those benefits are there for families who need it. The benefits that are there, they exist for the children. And if you can get your child to dental health taken care of, do it.
Another thing is, a few years ago, one of the stories that made national news was a 12-year-old Maryland boy and a 6-year-old Mississippi boy who died because of severe tooth infections. They were both eligible for Medicaid, but they didn't receive the dental care they needed. No one knows how many kids have lost their lives because of untreated dental problems. And as we said, it's not just you're going to lose a tooth. You could die from this.
Exactly. Well, and also, Adrian, you had mentioned that, Medicaid has low reimbursement rates and, burdensome administrative procedures. That's true to a point. Now, I think the state of Indiana has a where I live, has a fairly streamlined relationship with Medicaid. We really don't have that much administrative difficulty filing claims or getting paid. I think the trouble that we have with Medicaid, the amount of claims that are denied or the amount of times that you have to pick up the phone and call Medicaid to say, hey, what's the deal with this claim? Why isn't this paid? Is remarkably less than the amount of time that I spend on the phone every day with the bigger companies that people are paying monthly premiums through their teeth, through their employers, that look for any excuse whatsoever they can find to deny a claim. It's insane.
I've seen that so many times. Yeah.
I've worked in that place for 16 years. I think we're at a point where now more than ever, I spend so much time on the phone trying to. First of all, it's difficult to speak to a human being. Secondly, it's difficult to speak to a human being who can or is willing
to do something
to help you.
Yeah.
And we're also at a point too where, with the Affordable Healthcare Act coming into play, there are a lot more there are a lot more dental plans that are available for people to purchase. Now, our office is just now starting to see patients coming in with some of these new dental plans, and some of them are so new that I can call to get information on the plan, and the company doesn't. It's the company's plan, and they don't even know or understand the details or the benefits that come with it.
Don't you just love it, John? And I have this. It's not only in dental, but in so many other places where you actually. You hear, like, you call up the thing and say, oh, well, there's this benefit and that, and they go, well, I've never heard of about that. And you call back later and you talk to somebody else and they know about it, which basically means the education within the actual company is not being done correctly.
Yeah, and we have, there's a couple of the companies in particular, you can just tell that the communication is terrible. One person tells you one thing, yes, that's absolutely the case, that's absolutely how this is going to work. It doesn't work that way. When you call back, you say, well, I talked to this person, I give them the name of the person I spoke to, I give them the date that we spoke, I give them the reference number that I was given on the phone call. Well, that information wasn't exactly correct. We have to put you through to another department. There's so much. It makes a lot of sense to me that insurance costs as much as it does when there is so much absolutely ridiculous, redundant, and often completely incompetent bureaucracy in some of these companies. And they're not all that way. They really aren't. Most of the day-to-day work that I do is a breeze. But it's those few cases where there's obviously a lack of communication going on within these companies where it really gets to be a problem. Right. And again, as far as Medicaid goes, which we had mentioned earlier, I think that the state of Indiana has a really good system. We very, very rarely have any issues, and it's fairly easy to solve them when we do. But as you said, it's the parents who have access to this, or the parents even who have it, who don't have the initiative to wake up in the morning and bring their kids to the dentist.
John, I'm gonna actually mention, because we're gonna have to mention our heroes of the week very shortly. We're running out of time again. I want to mention 3 charities that are actually making a difference that people can actually have a look at. There's the International Dental Volunteer Opportunities, which is internationalvolunteer.ada.org. In 1971, the American Dental Association first published a directory of programs outlining the need for dental personnel and materials in a number of overseas communities. Since then, the participation by dentists and others in international volunteer dental activities has risen significantly. Check out the website. You can find out a lot of stuff about how American dentists are actually donating their time. There's also Ronald McDonald Care Mobile, which is www.ronaldrmhc.org/Ronald-McDonald-Care-Mobile. These will be on our blog and on our site very shortly, so you can check them out. They provide access to health care where children need it most. Ronald McDonald Care Mobile operates in vulnerable communities across the U.S. and around the globe. By providing cost-effective, high-quality medical, dental, and health education services, these vehicles literally open the door to health care for thousands of children. All Ronald McDonald Care Mobile services are provided in a 40-foot long, 8-foot wide, state-of-the-art vehicle built specifically for delivering pediatric health care services. So please check that website out as well. The last one is Global Dental Relief, which is globaldentalrelief.org. Their mission is to bring free dental care to children throughout the world. Volunteer dentists, hygienists, assistants, and non-dental volunteers deliver treatment and preventative care in dental clinics that serve children in schools, orphanages, and remote villages. Another great organization. Now, I know, John, that you actually have a Hero of the Week, which I want to get to because I don't want to run out of time for that segment.
Yes, very quickly we'll get to our hero here. Joshua Williams, 13 years old, from Miami, Florida. When Joshua was only 4.5 years old, he was at his grandmother's house and saw an infomercial for Feed the Children. And before he and his family left Grandma's house, Grandma, as grandmothers often do, gave him $20. And the first thing he did when he took that $20 bill was to say, I want to give this to those kids I just saw on TV who don't have any food. So at age 5, as with all of our Peace Run Radio Heroes of the Week, that initial act of giving, it just wasn't enough. It's like these kids they just get addicted to helping. So at age 5, he created Joshua's Heart Foundation, which you can read all about at joshuasheart.org. And in the time since he founded it at age 5, he has distributed over 500,000 pounds of food to South Florida and Jamaica, served over 100,000 meals, raised and donated over $250,000, donated over 20,000 pounds of toys, books, clothes, and toiletries and hygiene items, including toothbrushes, to children in need. He's involved over 650 other children in his efforts, and currently has a junior advisory board of 40 kids between the ages of 6 and 18 who are involved in this organization and looking for different ways in their own communities that they can help.
I think that's brilliant.
Yeah, really.
I think that's brilliant. At age 5, he started a foundation, basically, and has now donated over 20,000 pounds of toys, books, clothes, and toiletries. Oh, my goodness. It's a great story, John, because it's kids helping kids.
It is, and they have all kinds of really interesting things. They have a backpack distribution program where they fill backpacks with food and other items that children need that the children can take home, for the weekends. The children, they get these backpacks that have, meals in them, foods that are child-friendly, non-perishable, easily consumed, packed with vitamins. The backpacks are distributed discreetly at the schools so it's not embarrassing for the children who receive them. They have a birthday club where they go into schools and come up with gifts that are given to the school, and the principal is responsible for giving the gift to the student. So they'll make a birthday announcement, they'll have the child come to the office and receive their gift. They have a fruits and vegetables gardening program that they're going to take into communities to show communities how to grow and care for gardens of fruits and vegetables for sustainable, healthy food. It's absolutely incredible. And, Joshua, as I said, he has this advisory board of other kids. The ideas that some of these kids come up with are just absolutely amazing. There was one of the boys named Nate Noss from St. Louis who saw fields of unharvested pumpkins in his community and thought, you know what? We can take these unharvested pumpkins that are going to go to waste and turn them into soup and bread for needy families. There was a young boy named Kiran Sridhar in the Bay Area who came up with this idea for an internet-based program to connect hunger relief organizations with supermarkets, restaurants, and food providers to donate surplus food items. And that's sort of how he operates his organization, Joshua's Heart, is it's just wherever there are children who are willing to help, regardless of what the situation is in their community or whatever their particular skills are, they find a way to put those skills and the needs together to come up with these solutions. And again, we're talking 500,000 pounds of food to children in South Florida and Jamaica. And this kid is 13 years old. He's been doing it since he was 5.
Joshua, seriously, that is awesome. I think, and you're 13 years old only.
13 years old. It's amazing. And one of the really cool things too, I mean, obviously through doing this, he's gotten a fair amount of media notoriety as well. And rather than using that notoriety to further himself, the only thing he uses it for is to further the causes of the children he's trying to help. And I think that's one of the ways that it's been fairly easy for Joshua to kind of get his message out. So again, go to joshuasheart.org. There you will find the links to follow him on Facebook, on Twitter, to find out how you can volunteer and get these programs going in your own community. It's a really incredible organization that he's put together here. And again, it's run by a young man with an advisory board of fellow children. It's unbelievable.
Brilliant.
Well, John, thank you for bringing us that. Thank you this morning for joining us in your professional capacity, I would say. Yes,
and again, like I said, thanks again to Dr. Wilson Stem, who's has allowed me to be a part of the show from the beginning by letting me take that late lunch on Wednesdays, because he believes in the work that the Peace Fund and Peace Fund Radio are doing. So thank you, boss, for the opportunity to be a part of this.
Yes, thank you, Dr.
And thank you guys as well, because this is just the best.
Well, I tell you, I had a conversation with many, many people over the weekend, and some people have listened to the show, some people are going to be listening to the show. If it's your first time, welcome to listening to us. We deal with topics that are so varied, that deal from autism to homelessness to education to so many different things that... Actually, Ethan's waving at me at the moment.
I was just saying that now's a great time to point out not only the excellent work the Peace Fund does, but the work cannot continue unless you donate to the Peace Fund at
thepeacefund.org.
Exactly.
Okay, so I will be the one to step up and say it, because obviously our efforts need a little help from all of you.
Yeah, we're working on a few things. Our new site's going to have a lot of new things which you guys can help. And actually, thank you for all your volunteers. We're actually putting together our first paintball competition, and we're looking at our logo right now. We're kind of not quite there. So if any of you have we're actually looking for some artists that are, cartoon artists that do small figurine type stuff. We're looking for a couple of artists of that nature as well right now that might be able to give us like a little added bonus to our logo and our stuff. So if any of you are out there, we would love to hear from you. Thank you to all of you listening. Thank you to the Speechley family for listening to us or helping us bring this show to you. Obviously there are many, many people behind the Peace Fund that let our organization run and do what we do. They work tirelessly and do not get paid for it. We pay for only a very small portion of what we do, and 94% of what we get goes to the initiatives that we are in partnership with, or our own initiatives that we put forward. So we do thank you all for your time, for your effort and your passion in changing the life of many kids out there. In closing, I'd like to say a quote by Garrison Keillor. Nothing you do for children is ever wasted. They seem not to notice. They don't notice us. Sorry, I'll repeat that again. It was a bad quote. Nothing you do for children is ever wasted. They seem not to notice us, hovering, averting our eyes, and they seldom offer thanks. But what we do for them is never wasted. This is Adrian Paul and Ethan Dettenmaier. We'll talk to you next week.
You're listening to Peace Fund Radio with Adrian Paul and Ethan Dettenmaier, right here on LA Talk Radio.